Ginger, the medicinal gift for motion sickness and arthritis. Hi, I'm Dr. James Meschino. Ginger is native to southern Asia, and it's been used as a food and medicine in much of the world for thousands of years. Now, the active medicinal ingredients in ginger are these gingerols, which are sort of a collective group of aromatic ketones for you science nerds out there. Now, what are the health applications? Well, there's certain things we know that these gingerols can do. Been used very effectively for motion sickness and nausea and to sort of contain vomiting. How does it do it? It appears to act directly on the intestinal system to reduce nausea by sort of inhibiting the gastric motility, or the contractions that are related to intestinal wooziness and that feeling that you have before you're going to vomit, and all the nausea that goes with it. That's different than when you take anti-nausea drugs, which really act on the vomit centers in the brain, or they act on the inner ear. Whereas gingerols are acting directly on the stomach to sort of stop all these motility activities that are going on and sort of silence them, not acting directly on the central nervous system. Where gingerol, to me, has tremendous application is it's an unbelievable anti-inflammatory. So it has these anti-inflammatory effects. So clinical studies in human subjects that have a variety of different arthritic conditions and musculoskeletal inflammatory conditions like rheumatoid arthritis, osteoarthritis, other inflammatory muscle and joint problems, you see significant benefit in these patients when they're given the right dose and the right standardized grade of ginger. And how does it work? It works almost sort of like aspirin by inhibiting the synthesis of these inflammatory prostaglandin chemicals, by inhibiting these enzymes like cyclooxygenase and lipoxygenase. This is how aspirin is working, by blocking some of these enzymes that lead to inflammation. Well, the gingerols are doing the same thing. They also have antioxidant properties. The nice thing about gingerols is that even though they work sort of like aspirin or ibuprofen or indomethacin, they're not causing the side effects. They're not causing GI intestinal bleeding. They're not causing internal bleeding. They're causing liver damage, not causing kidney damage, not increasing risk of high blood pressure and so on. So it's a safe way to get this anti-inflammatory effect. So what you ought to do is click on the link below, read my review article on ginger. By the way, it has some very impressive anti-cancer properties that we've seen of late as well. But in my review article, you'll see the effective dosage and the right standardized grade to use, so you make sure you're using it in the most effective way. But you also have to know there are some drug-nutrient interactions around ginger, so you don't hurt yourself. So you'll learn how to use it safely, and also how, if you use it the wrong way, it can actually cause some stomach damage. So it's important to know these details so you don't waste your money or harm yourself by using a supplement in an inappropriate way. All the scientific references are there in the article, so you see that you're getting sound evidence-based information from me. So click on the link and you'll learn a lot about ginger. It's an herb really worth knowing about. Now, at MeschinoHealth.com, you'll see my other research review papers. You'll see live footage from my professional seminars, other downloads and resources and videos I've created. They're all there to help you lead a long, healthy, functional life. All my research review papers and teaching materials are complete with all the scientific references. So you'll see you're getting only scientifically based information from me on any health topic you're looking for. So you should use MeschinoHealth.com as an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.